Everyone, thank you so much for joining us. While you're all settling in, we are going to start getting started. Welcome to our San Joaquin Stanislaus session 5. Next slide, please. Just a friendly reminder that this session is being recorded and we will share a deck shortly after the session and we'll drop it in the chat at some point today. Please, next slide. My name is Melissa Meza. I am a senior program manager here at Help Begins, and I will be facilitating today's session with Gretchen and John. Next slide. We want to thank all of you in the room for joining us. This is a space for regional Medi-Cal transformation stakeholders to collaborate, identify challenges, and problem solve with the goal of improving CalAIM implementation and driving utilization. So welcome aboard. We do welcome questions. Please use the chat as well as unmute during the session. And we would also welcome you all to please turn on your cameras so we can see your beautiful faces. If you are new, please let us know in the chat and we will reach out to you and try and schedule a one-on-one. Next slide. Okay, just a couple of housekeeping items. So for all of you who are joining us today, if you can please update your name on Zoom and include the name of your organization. If you prefer, you can also include your pronouns. We also have a chat icebreaker. We want to know, what is your favorite summer activity? I'm going to go ahead and drop that in the chat right now. And just want to see what everyone's favorite summer activity is. We're also looking forward to a dynamic session, so please feel free to use the chat. Like I said, you can also use the raise hand function as needed for questions, networking, and feedback. We also encourage you to connect with our facilitators. You can either send us a direct message or send the message to the entire group. Fishing, ooh, hiking to mountain lakes and going for a swim, boating. I love it. Do our facilitators want to share what their favorite activity is? Oh, I see. Oh, sleeping. Okay, John, you can hop off and just go take a nap if you'd like. All right, next slide, please. For today's objectives, we hope that you will A, receive important DHCS, managed care plan, and peer updates and resources. We do have a very jam-packed session today, and you'll see in our agenda later today. So please be patient with us as we run through everything. We also hope to hear from and build partnerships with local providers, connect with work group members to discuss continuing implementation intended to accomplish our 2024 goal. And then we'll close out by receiving updates about the upcoming in-person session and support planning efforts. Today we'll actually break out into work groups as well. So next slide, please. As I mentioned, we do have a ton of items to cover today. So right now we are going through our welcome and level setting. This includes our welcome and session objectives and agenda. We will also go through updates and resource sharing. This includes our DHCS updates. We'll engage in a quick discussion to provide DHCS with some feedback. We have 2 provider spotlights today, and we also have some space to hear managed care plan updates. For part 3, we are continuing our goal implementation. So we established a goal earlier in the year, and we are aiming to meet this goal by the end of this year. For today, we'll go into in-person session updates and also discuss work group breakouts. And then we'll close out with some next steps and also touch on office hours and one-on-ones. Next slide, please. Okay, that's enough for me. I'm going to hand it over to Gretchen, who will lead us through a few updates and resource sharing. Thank you so much.
Great. Thanks, Melissa. Hi, everybody. Hope you're doing well for a Monday. Let's go to the next slide here. So there was a lot of things that happened with the May revise of the budget, but we're not going to go over those quite yet. I think we're all still trying to digest what they all mean. But there are a couple other ones that we wanted to make you aware of today. So one is that the state is really wanting to make sure that all of us are aware of their 2024 managed care plan transition guide. It does try to clarify some of the guidelines of how care should be transitioned for individuals between managed care plans. They did put out an updated revised guide at the end of March that talks a little bit about the changes in reporting dates for certain elements, and some of the oversight and monitoring isn't also detailed in this guide. So if you have any questions, it's a great resource. Please check it out. We have the link here and on the chat. Thank you. Next slide, please. So one thing the state has been working on for a long time, and I know you guys probably have provided feedback over the past several months on this, but they are really trying to create some policy changes that will improve the referral and authorization process for ECM across the state. And we hear there's some new changes coming down, not only for ECM, but also for community supports. We expect them to have some more standardization in terms of the forms that are being used. We do anticipate having some pre-authorization processes approved. So we're hoping that will come out in the next month or two. So just wanted to give you a heads up that those are coming. And of course, as soon as we get them, we will share them with you. Next slide, please. All right, so one of the things that we have been working on with the state for several months has been looking at, not only are we trying to improve our referrals and authorizations for ECM, but trying to make some other changes as well. Next slide, please. And the state has put together some pieces, they're calling them levers, that are really wanting to focus on for improvement for ECM and community supports. And so they have 6 different ones that are laid out here, and they are asking for feedback from all of you for these 6 levers. And so we wanted to just kind of go through a little bit of what each one means and open it up. If anybody has any burning comments or feedback they would like to give the state, we would love to hear it. So the Health Begins team, we're going to be meeting with the state and other facilitators in a few weeks, and they want us to bring feedback from our participants to share with the state and with other facilitators what's working, where are the challenges. I think there's a lot of great things happening here, and so if we can share best practices, we'd love to lift those up as well. So the 6 levers that we're looking at today, the first one is around trying to standardize eligibility for services and for populations of focus. Lever 2 is looking at streamlining referrals and increasing sources. And of course, we know the state is really wanting to get most of the referrals coming into ECM and community supports from the community. And so looking at how do we do this? How do we create stronger systems to generate those community-based referrals? Lever 3 is around streamlining authorization. So what does that look like? What's working? Where are the holdups? I know we have a lot of different ideas coming out about ways to improve that. So would love to hear what's working for you guys, maybe where some challenges still exist. Thinking about how do we expand our provider networks and streamline payments, just a small topic in that lever. Lever 4, no big deal. And lever 5 is one that I think about a lot, and I'm going to be a little crass here. The state has said, oh, let's about strengthening market awareness. I think about this as marketing. And so what marketing needs to be done to kind of generate more folks who can benefit from these services? How do we let folks know these are legitimate services that are being provided by legitimate providers? So thinking about marketing techniques, I'm sure you all have flyers and brochures and social media posts you're using. So if you have one that has been really successful, would love to hear about that. I have some providers in other counties that are trying to generate QR codes so that folks can make an easier time of self-referring into the programs and services they need, which I thought was a really cool idea. Would love to see what's happening here. And then lever 6 is looking at how do we improve data exchange? Again, another really small topic that I'm sure you all spend a lot of time thinking about. So I'm going to open the floor up here. If anybody has any burning ideas or things they want to share with the state, both successes as well as ongoing challenges, love to hear it. And Matthew, I see your hand is up. So I'm going to give the floor to you right now.
Hi, good afternoon, everybody. I think it's such an amazing service that's available to a population that needs it so much. But, I think it's evident that not enough people know about it. And, on a provider standpoint, something that we've implemented in other counties, and we're looking, is kind of our first pilot. Now we're looking to bring it into other areas we serve, is hosting community health fairs. So bringing together a lot of local vendors that are in, the health space, maybe local health plans and kind of everything in between, and bringing them together, and having members from the community. So it's, the essence of ECM, right? Meeting members where they're at and going into a local park that is directly in the neighborhood that these individuals live in, and having resources available, having some giveaways, just get a chance to meet with the community. And yeah, things like QR codes have been awesome. Getting a chance to self-learn and kind of meet maybe your future LCM there, even before you come into the program, and meet people there and answer those questions and set realistic goals. But also too, in terms of a bigger overview, something that, could be done from the DHCS level is, advertise at bus stops, right? Or areas, the community clinics, the FQHCs, advertise for these services where these individuals go and frequent, or a media pitch, put it out there. I mean, it's such an untapped resource that so many people need. So that would be my 2 cents. Thank you.
Awesome, Matthew. Thank you. And I'm going to actually make a plug for you to join. We have some breakout rooms coming up later in the session, and we have one on resource fairs. So I would love to have you bring your expertise to that work group as well. Thank you. Anyone else want to jump in here and share some ideas or things that you're finding that works either in these 2 counties or in other counties you're working in? Would love to hear your experience. So I have a question. I'm going to just a little bit on this marketing thing. Are folks using texts to reach out to folks? Do you have any like text scripts that you're using for standardization in terms of marketing? All right, Candy, you're not doing that. Okay, thanks for letting me know. I know. So I've been thinking about this a little bit to see if that's something to use. I know for certain populations of focus, children and youth, texting may be mostly for the youth part, maybe something to think about too. So besides the marketing lever, anybody else want to jump in and share something? Matthew, I see you come up.
Yeah, I'll back to somebody was saying, we do like to get consent for text messages before, but in the initial outreach process, I think the issue, even with if it's a telephonic outreach, or even in person, is the fact that many people think that it's a scam, and I think a text message would further that inclination on somebody's end. So that's definitely something we have to change. But again, if they've heard it at their provider's office and they've seen it at a bus stop, then like, okay, well, maybe it's not a scam.
No, great point. Yes, and Katie, thank you for raising the consent issue too. I think that's an important one, especially with certain populations of focus. All right, anybody else?
Oh, this is Annette over at St. Joe's, and when I was working with the individuals, it was texting that kept me in touch with them the most.
Okay.
It was definitely by far the most successful way of communicating. And so I definitely see that piece, because most of them will have at least somewhere that they can go to get some kind of internet, and it allows them to look at it at their own time when it becomes available. So I found great success with that.
Great. And did you talk to them on the phone first or in person first, and then continue the relationship with the texting, or how did it work for you?
Generally was in person, because they would have been
Okay.
in the hospital, and then sometimes I would even text them to give them my number so that they knew it would be me, or and then when I text, I kind of made sure I did the introduction piece too.
Okay.
Yeah.
So that's good to hear. All right, perfect. Okay, I see that you're asking for the link, provide feedback to DHCS. So we're actually doing it for you guys. So we're trying to collect things. So if you have ideas or things you want to share, drop them in the text, or you can jump in right now, whichever works best for you. But we're trying to gather all that information to share at a big in-person meeting we're having with DHCS in a couple of weeks. All right, well, I know we're running tight on time today. So if nobody has anything else that is calling them to speak, I'll ask you to drop your feedback into the chat and we will continue on. I'm going to turn it over to John.
Yes, good afternoon, everybody. Thank you for being here. First and foremost, I just want to say I appreciate Annette DePauli providing some overview of her new organization. I've worked with Annette for numerous years now, while she was at St. Joseph's. providing excellent service for our like clients. Prior to COVID, we were working together, assisting our clients get connected with level of care. And then once COVID happened, she was very influential in filling up our COVID isolation house there at the Gospel Center Rescue Mission. And then also afterwards, now at St. Mary's, we've been working together in referrals and getting into clients into her systems of care. So without further ado, I'd like to introduce Annette DePauli.
Well, thank you, John. I appreciate you and all that you do for this population and our relationship as well. It definitely has taught me a lot and helped me do what I do. So thank you. So I'm here on behalf of St. Mary's Community Services. I transitioned over to St. Mary's earlier in January, so still a little bit new, but have been associated with St. Mary's for quite some time. It's currently called St. Mary's Community Services. Prior to September of last year, it was St. Mary's Dining Room. And so it's grown and changed and is constantly changing with a lot of things ahead for us. So I'm excited to tell us about what we're doing and where we're headed, and be open to any kind of feedback and thoughts to that as well. Next slide, please. So as I mentioned, St. Mary's has started out as a dining room when one of a priest, Father Alan McCoy, decided that he was going to start feeding, quote unquote, the homeless. And so he started with this opening a type of restaurant in a bar, and back in 1955. So we as a homeless shelter and feeding hall has been around for quite some time. Eventually recognized that dental was a big piece of need for this population, and opened a dental clinic on site for that grounds. In that meantime, they had kind of relocated and has an opportunity. We continue to have the dental clinic for the uninsured or underinsured. It is all staffed by volunteer dentists, and we have 2 paid staff as dental assistants, but we serve anywhere between 50 to 75 people a month. Have a wait list, but we call them in as soon as we can because it depends on when our dentists are coming on board. But it's a really great service, and we have a certain amount of funding that we can do to buy dentures, about 10 dentures a year, but it is significant. We also have a hygiene house that was built, and that is 2 large hygiene area where people will come in. They have separate entrances for the male and female. They have full clothing closets where they can go and exchange their clothes. We do take them, and if we can, we wash them and put them back on the racks, even though we have a lot of donations for as many of the people that are showering. We really try and rotate the clothes so they come in and they can get fresh clothes, take a shower, and that is for not only the people on campus, but also the people that are into the encampment. So it's open for both. And then in 2009, there turned out to be recognizing that the importance of case management advocacy. And so there was what we call, quote unquote, the resource center. Started out with someone who is just an amazing woman, Mercedes, if you haven't met her. She's led the charge in this category and really started helping people with their different types of needs, and has continued to grow. So it was kind of the early beginning of ECM back in the day. From there, in 2023, what was the Stockton's shelter for the homeless had some challenges. So it was asked if that could be incorporated with St. Mary's, even though we've all been on what appeared to be like one piece of land. We were right next to each other. They were 2 separate organizations. So in 2023, it all merged, came under St. Joseph's oversight and operation. So then it became St. Mary's Community Services. So fortunately, we kind of are now a one-stop shop, which I think is a really great model. But there's been, a lot of growth and development along the way, and so we're still learning how to be the best that we can be. Lots of room to growth and improve still. Within that time, back in November, started the recuperative care. We have 20 beds on site and 9 that are in a house. Eventually, those will all come on to our location, and I'll explain that as we go down a little bit further. We do have a day program for older adults and women so that they can go somewhere during the day. Everybody does need to leave the actual shelters during the daytime, and it's hoped that women will, people will go out and find jobs and do the different types of things, but we do have a day program for those who aren't able to do that. That we're very fortunate to have a medical center from CMC, Community Medical Centers, on site previously that had been a volunteer medical clinic, similar to the dental clinic where it was all volunteer doctors. But the challenges with that, and we had the opportunity to partner with CMC, which has been really a wonderful opportunity to have them there on site. So that's, and we then, our most recent addition in regards to some of the funding sources have been the outreach team, which is partially part of the answer to the question that you were talking about as far as outreach and marketing. Our outreach team really helps out a lot in that category. Next slide, please. As I mentioned, we are kind of a one-stop shop. We've been, it's just been a wonderful opportunity to really create that type of environment. The dining hall, again, serves 3 meals a day for anybody who wants to come in and have a meal. We ask very little information. If you need, come in. So in families, everyone. So we're serving about 400 a day. We have the social services, which is what they call the resource center. That's where our ECM is held, and we're growing those services as we are able to do that. The emergency shelters, we have 3 of them. We have the men's, we have the women's, and then we have the family shelter. So those are actually staying full for the most part. We may have 1 or 2 beds a night, which is a really great number, meaning that people are using the location. Obviously lots of room for more, but we're feeling good the fact that people are wanting to come on site and use the beds. And then the recuperative care, as I mentioned, we just recently expanded that into a much better location, trying to learn the ropes on that and improving as we go. Day program, we do have that. We're hoping to expand open a meals area come summertime. The dental, the hygiene, housing navigation. We have a full housing navigation team, triad, have housed 69 people since we started that, and we have quite a few ahead. A big partnership we have with them is with the Stan Housing, for those that are familiar with that here in San Joaquin County, and are expecting quite a growth and expansion. So hopefully we'll be partnering some more with everybody in San Joaquin County to house more people. And we do hold a homeless court on our site, and we are looking at maybe doing care court. Next slide, please. Our vision is to envision a community where all are empowered to have the support that they need to meet the physical, emotional, and psychological needs. We're really trying to create a healing environment. My goal is to really bring services to this population so that they can come on board and receive the skills that they need to help them be successful in long-term housing. That's our big ramping up right now. The goal, again, is to really prepare them for going into a permanent shelter type environment, and then continue to support them as they're maintaining and developing those skills. Next slide, please. Becoming CalAIM providers. So this has certainly allowed us to expand the services that were so greatly needed. Interestingly, as kind of mentioned, is that some of these services were being provided on a more donation level, or from whatever funders we had at the time. So this has really been able for us to take what has worked in the past and implement it more farther and wider with more people. With that, then we are working at case management, everybody who is staying on the shelter, and really working hard to get everybody talk to everybody that comes in, hopefully within 24 hours, get them signed up for a case management appointment within a short period of time, like within the week, get them on board and get a plan in place. If they already have an ECM provider, making contact with that provider and letting them know that they're there, and so they can kind of find them and come and do what their plan is and really support whatever plan's in place. It has allowed us to expand the recuperative care, which has been a really wonderful service. Lots more on that one, and the day program. I particularly am fond of the day program just because so many of our folks are just there and have need some support and entertainment and learning skills. And so it's really trying to build that up so that they're getting information and support that they need to help them build up their own selves, their self-esteem, and the skill level for them hopefully going into housing. And most importantly, again, with CalAIM is the sustainability of the services, and knowing that we can start implementing and feel solid about that, and bringing staff on that are qualified to provide the services. Next slide, please. Oh, our success. This is one I'm very proud to report. We just recently had a couple of our female clients who were living in our recuperative care. This is not her. This is a different person that we've had the approval to take the pictures on, but came into our recuperative care. One of them was really very down and out, had just been told she needs to go on dialysis, was very afraid of what that, didn't really even understand what that meant. And so just was kind of ready to give up and really didn't want to live anymore. But with our health ambassador, who is a relationship, it's kind of a CHW that we have a partnership with St. Joseph's. She was able to really reach her and touch her and walk with her through the process of going to her doctor's appointments, understanding what dialysis meant, that she would have the support she needed. We put her in the recuperative care. Then she was able to make her appointment. She got on dialysis and really stabilized. During that time, another one of the women that was in the recuperative care, they befriended each other, became very close friends, and both of them became stable. And we just moved them out last week into a 2-bedroom duplex where they're going to be living together and support each other. So that was a really great one as well. And yeah, so that was a good one. We were all celebrating that particular move in particular. It's a lot of work that went into that, a lot of different partnerships, and just proving that the system can really make a difference and it works. Next slide, please. Our goals here again is to have everybody in case management with a long-term plan for housing and the support that they need. We and again, we house from all over the county. So even if it is a different provider, the ECM are able to find their folks, have a place to meet with them, and really support the goals that provider is working on with that individual, and hopefully bring the skills on board to help support them as they're moving forward in their plan. And one of my really big goals is to really focus on our community partners and work together, because we're fortunate to be having what we call Pathways Neighborhood, which is a large modular unit of about 225 beds that will be hopefully opening in December of 2024. Construction's always a little bit unpredictable, as we know, but this is to help meet an unmet need here in San Joaquin County, or especially in Stockton, of people that have pets or couples. They aren't able, there's really not a location for them to live together or to stay together, to meet that need, to grow the recuperative care as needed. And then anybody else who would have special needs. Sometimes this would be maybe some of the substance use that might be needing some extra space, or we might have some with mental health issues that are just starting their medications. We can support them through that, where they don't have to live in a dormitory type style. Some of the rooms will be small dorms, but it'll be a little bit more able to manage. We have certain person with medical needs that really need a more privacy than others, or more of an isolation. So really working hard to try and meet some of those unmet needs that are people are not able to stay in shelters for one reason or another. And then we have a navigation center that's being built. That was a City of Stockton project. Unfortunately, we had some challenges and it's had to have some remodeling attached to it. So that'll eventually be opening. And some laundry services. We do have Loads of Love coming on site. We're very grateful for that partnership, but always use more, especially in the shower category. That is probably one of the biggest needs that we have right now, is just having people be able to get their showers. And next slide, please. Our challenges, getting trained staff. We've definitely found that people with lived experience offer a unique perspective and really can make a bond, and is proving to be quite successful in that respects. And just getting the right people in the right places and bringing services on to making those connections and bringing them on to site. Obviously, there's just so many different types of issues with the homeless population. So really trying to address those. Some of them are easier than others. Again, the supportive resources into the community. And then, of course, just in general, affordable housing availability. Fortunately, again, we do have that relationship with Stand. We have potentially up to 17 community neighborhood houses coming on board. Most of them are 4 bedrooms. Some of them are 3 bedroom and 1 person per, and it's like $650 a month per bedroom. There's only 1 person per bedroom. So it is community living, but it is an opportunity for them to have a progressive move into the community. And that's where that case management and navigation to sustainability and tenancy really makes a big difference for us. And just accessing resources and keeping that whole process going and making sure, because it, as we all know, it is expensive to run these locations. And so even with the reimbursement rates, we're still needing to get additional support to be able to keep everything running as we would like to see it happening. And next slide, please. Collaborative participation, building support and relationships in the community. There, it is one thing I think for those of us that have been doing this for a while, we know that we the better our relationships, the better, more successful we're going to be, such as with John and SJ Health, CMCs, Gospel Center Rescue Mission. I can't tell you how much I appreciate each and every one of them, and as well as all the other supportive ones, Loads of Love, and just so many different communities that make this all happen. And that's really one of my big goals, is to build and strengthen the web of support throughout the community. So we're very grateful for that. And so really appreciate being on the call and hearing everybody else's ideas and support in that category as well. Next slide, please. I think that's us. Any questions?
I had a quick question, Annette.
Yeah.
So your information is in the chat, because I know there's probably going to be an overwhelming of people reaching out to you for your services, like recuperative care and your other services. So please, if you can, just put your information in the
Sure.
chat for them to have. Thanks, Annette.
Absolutely. Thank you. Anyone, please feel free to make contact if you'd like to come see the location or have a feel for it or learn more about it. We are here to serve, and that's our goal. So really would enjoy sharing and being partners. Thank you.
I don't know how to raise my hand, but if I may really quickly, that is very impressive. Very impressive. And you just really need to accept a pat on the back for what you've done. And I would love to come and see these facilities. I would love to. I'll reach out if I may.
Absolutely. Please do.
Thank you.
You bet. I'll get my name in there when I find that chat. We are in downtown Stockton, a term I recently learned. We're at the 4 and 5. So we're Highway 4 and Highway 5 cross each other. So right on the corner of how I-5 and then the downtown freeway takes off. When you look down, you will see that's our campus.
Okay, well, thank you, Annette, for that. And like I said, please put your information in the chat. I know you showed it in the very beginning, but definitely want people to reach out to you guys' organization.
Sure, thank you.
So next, please. Our next regional spotlight is Independent Living Systems. They are an LLE for Kaiser, which is very exciting to me because I do get a lot of phone calls weekly of Kaiser members wanting to know who to connect with. And so this is a great opportunity for me to get to know Independent Living Systems. So without further ado, you're next.
Thank you, John. I am Sarai Soto. I'm so happy to be here. I'm kind of filling in, but I wasn't going to take a chance of not presenting because this is a great opportunity for us to kind of say who we are and what we're doing. So Sarai Soto, I've been with ILS for about 3 years. I serve as a special projects director in the California region. Our Mojo, we are in our model is that we're a compassionate team committed to improve the quality of life for vulnerable populations through our diverse partnerships. We ensure person-centered comprehensive health and social care for those that we serve. Our Mojo is you matter and we care. ILS is a company that started in Florida and expanded out in California in 2011. It has been in business for about 30 years. We provide direct services in 39 counties for California with ECM and CS services. Like John said, we are one of 3 network lead entities that handles CalAIM services for KP. Our website is below there, and that's my contact information. I'll put it on the chat after we're done with this. So if you guys do have questions, I will direct you to the right people. Next slide, please. What made us decide to become CalAIM providers? So interesting enough, ILS has a specialty in programs to keep people independent at their home. So due to the long-standing relationship that we already had with Kaiser in Florida, we were invited to start a pilot program in California. So that's how we got all started. So as we have worked with these vulnerable population and members, it was only natural to expand the capability as CalAIM came into existence. So now we serve about 16 plans through the state of California through CalAIM and other community-based care management programs. So we're pretty big and just going. Our current goals, it's to meet the specific needs of the vulnerable residents in each county, engaging local staff. As you know, we hire more staff and we try to get them engaged to do this. Some of our challenges, and I guess one of the challenges, which is why I wanted to present, is that we kind of are being seen as a new kid on the block because we are not local, we're everywhere. So building relationships as we increase staffing through the county is one of our main goals. How will we leverage participants in collaborative? So for me, the relationship is always a key. Networking with other providers and building a trusting collaborative relationship is a key because at the end of the day, it benefits the entire community and those that we serve. Next slide. So one of the things, as I said, we provide ECM and CS services. And when it comes to community support, we have provided everything that is in community support. Another new program that we had was our community health program workers. So we have expanded and that's our newest program right now in the state of California. And it's pretty impressive the work that our CHWs do with our current members. Next slide.
Navneet, can you refresh the slides? There's one other slide from Sarai in there. Thank you.
Thank you, Melissa.
1 second.
In the meantime, if anyone has questions, I can take one question for now.
I have a question, Sarah. So
Yes.
you participate with all 14 of the community supports that are offered? Or
Yes.
Okay, perfect.
Yeah, we definitely do. We do housing deposits, housing navigation, housing in transition, and then everything else that is coming through the pipeline. We are providing those services. The most recent one that I can speak on is our community transition services. That's our most recent one that we have provided. And what I wanted to share amongst that, does that answer your question, Mr. John? Here's a beautiful success story that we have. We had someone that was at 23 that was diagnosed with bipolar disorder, asthma, and an eating disorder. So after our team, what we call community outreach workers, they did intensive outreach efforts, and the member was initially assessed, and the assessment was completed in 2022. At the time, this particular individual was living in a transitional housing. She was not compliant with her prescribed medication, so had lost custody of her child. Her ILS care manager worked with her to identify a care plan that was appropriate, and that took priority in kind of seeing what type of housing this member would qualify for. Parenting classes as well went along with that ECM referral. And they found a new PCP, they behavior as well as behavioral health services, and dental services. Lastly, the vision services and vehicle repair assistance. So if you see this case was pretty complex. And what our team did as a case manager, they looked at every single aspect of this member's individual, and they were tasked to do, to find the appropriate providers for this particular case. The member was presented in case conference, and as soon as that we heard that the member was evicted from her transitional housing unit, then the care manager made the instant referral to our housing navigation program. After that, they began assisting and coordinating with the housing portion. Over the next 5 months, more than 90 encounters have been documented on eCare for this particular member. With considerate advocacy, the team was recently able to obtain in Los Angeles the Homeless Service Authority problem-solving funds, which obviously assisted this member in this particular case. So she went from having temporary housing loss to being housed permanently and stable, and was able to take advantage of what our county in LA does, which is the problem-solving funds. Her mental state was stable after they found the housing, and she established and maintained the essential, trusting relationship with those two the care manager and the housing navigator. So we have a lot of stories like this in ILS, because our folks that we have as housing navigators or care managers or CHW, you name it, they're really involved in every county that we have. And they really know their resources, and we work as a team. If they are not able to collaborate with another agency to figure out this, we case conference our members to figure out as a team what's going to be the best solution for each member. And I think that works wonders, because it doesn't just fall on one person, it falls on all of us to make sure that every member that comes to our doors is has every single resource that they can benefit from. Okay, I think overall, I think there's another slide after this. Correct me if I'm wrong.
I don't think so. I think this is the last.
Okay.
But wanted to open it up if there's any questions.
Sarai, could you share a local contact? I know you guys provide support services across the state, but do you have a local contact that you can share for the rest of the group?
It would be the independent living systems contact, and they would go through there.
Okay,
I'll put it on the chat as soon as,
thank
or I'll
you.
send it over to whatever. I can do both.
Thank you.
Any questions for any of our providers that are on this call? I know I've chatted with a few of you during our in-person meetings, and it's always nice to see everybody in person and put a face to the agency. But yeah, that's, if you guys have any questions, let me know. Another highlight of our successes. Over the past few years, one of my special projects is housing deposit. And with that housing deposit, we've been able to house 179 people throughout California. So that just speaks wonders to the work that our staff is doing, and, you know, how we engage those members in providing a whole person care type of mission that we have with each case. I believe the count for Northern California, more where we're at now, it's about 86 members that have been housed using one of our services.
That's amazing. Amazing, Sarah.
Thank you. And we are trying to really collaborate with each county all over Northern California. I probably take care about what? From the 36 counties, probably 12 of the counties. So it keeps me pretty busy. With HMIS, with housing deposits, with CHW, you name it, we are out there just trying to not only be part of the solution that everybody's encountering, whether that's referrals, whether it's HMIS, whatever that is. So we're really trying to establish those relationships with each one of you that provide these type of service to help, not only strategizing what is the best solution to have systems in place, but also to, you know, figure out at the end of the day how these members are going to be successfully impacted with our services.
So that's a great segue into, you know, what I'm going to ask now is if anybody wants to present just like Sarah and Annette did, and put their organization out there so we can better connect and be impactful in the community. This is a great opportunity to just send us an email or put it in the chat that you would like to discuss your organization and how successful they've been, and even the challenges, because we're all here working together to try to help each other. And at the end of the day, we want to be impactful in the community, just like Sarah and Annette have. So please let us know. This is an opportunity right now if you have anything, or just put it in the chat.
Either we have an awfully quiet team, or I did a really good job on the presentation. So I'm going to take the second one. Did I talk about population of focus? The population of focus for us is mainly adults and children. The only population of focus that we're not right now directly working with would be the justice involved population. But I can see it coming eventually through our pipelines.
Wonderful. That is good. That is good information, especially with working with children and adolescents also. So thank you for that.
Yeah.
So we appreciate that. So I see some people have actually put into the chat that they would like to present in the future. So great. Thank you so much for that. I appreciate that. So I owe it all to Sarah and Annette for doing great presentations and getting people on board. So thank you both.
Thank you. And I just want to say for our first presenter, she did an excellent job, and, you know, letting us know what her agency did. It's amazing. So thank you for paving the road for this next presentation.
All right. So next slide, please.
Okay, it looks like it's my turn. Next slide, please. So we're going to go through a few managed care plan updates. We do have a few minutes left before we transition into breakouts, so just want to do a quick time check for everybody. Next slide, please. Okay, Eliana, I'm going to pick on you. I know we only have 2 slides here, but just wanted to give you an opportunity to talk about the ECM benefit again, if you're there.
I'm here.
Okay, Go ahead.
Thank you so much. Hi, everyone. Good afternoon. My name is Eliana Argueta, and I'm a regional program manager at HealthNet. Thank you so much for all those wonderful updates on what's going on in the community. It's always nice to hear how these CalAIM services have been implemented and some of the successes as well. I wanted to share with our providers the HealthNet ECM incentives. These are incentives that have rolled over from 2023. There's a total of 9 incentives that are active for all ECM providers. ECM providers have to have good standing with the health plan, and a few other requirements. But if there are any particular questions in regards to the incentives, please reach out. The incentive letter is actually linked right to the, if you can see the top of the header, it's linked right to that. I do want to call out a few different incentives. Some incentives include outreach and reporting within the first 90 days, enrollment effectiveness, which, we know that right now all health plans, and just I think a wholesome effort is enrollment effectiveness and learning a little bit more, how can we enroll more members into ECM services. Additionally, we're looking to incentivize completion of the capacity reports. This really helps us inform how many providers we need in the community, how many providers are ready to serve our members. Additionally, referrals to community supports, particularly using our Find Health platform. The next incentive is HEDIS performance of ECM enrolled members. This is going to be directly related to those members who have uncontrolled diabetes or HbA1c above 9. The next one is HEDIS performance of ECM enrolled members with the diagnosis of high blood pressure, reduction of avoidable ER visits, as well as scheduling follow-up scheduling follow-up visits 7 days post-hospital discharge. And the last one being community referrals for ECM and CS services. So again, the actual letter is linked to the header of this slide. But if there's any questions, and if you are a provider and you want to learn a little bit more or do a deep dive in regards to these incentives, please reach out and let me know. And we can go to the next slide. We also have a HealthNet ECM enrollment bonus. This bonus is through the period of March 1st through June 30th. The incentive bonus is for, again, those ECM providers. And so HealthNet is offering a bonus incentive of $150 per enrollment for every new ECM enrollment of unhoused members disproportionately experiencing homelessness. This bonus incentive is in addition to the existing plans or the existing incentives that I just mentioned. And to be eligible for the incentive, again, you have to be in good standing with HealthNet, be contracted directly with HealthNet as an ECM provider, and have the capacity to serve new HealthNet members eligible for ECM services. So again, if you are a provider and would like to learn a little bit more about these incentives and how you can take advantage of some of these opportunities, please feel free to let me know. I'm going to drop my information right in the chat. And I can take any questions that the team may have right now. Great. Everyone's excited about the incentives, and I'm sure you're going to be clicking on that link and learning a little bit more. But again, if any other questions come up, I'm going to be dropping my information in the chat, and I'm open to any questions. Thank you so much.
Thank you so much, Eliana. Next slide, please. Okay, so we do have a quick update from Kaiser Permanente about their complex care certificate. Do we have someone from KP today?
Hi, this is Sari White. Apologies, my camera is not working. But it is so nice to be here with you all today, and likewise, really wonderful to hear about from the presenters, and grateful for the partnership with ILS. So thank you so much. I am here to also provide an update around the complex care certificate. So KP is working with Camden Coalition, and we have offered this certificate for frontline complex care practitioners. So really anyone practicing complex care across the setting, different organizational types. We are providing 13 CEUs, or the course provides it, for nurses, CHWs, PAs, social workers, case managers, physicians, and psychologists. So we're really thrilled with this course. It's 9 self-paced online courses. And it overall provides frontline complex care staff with just the general knowledge on how to engage with individuals with complex health needs and social needs. So I will drop the link in the chat, and also provide my contact information. And feel free to reach out with any questions.
Thank you, Sari. Next slide, please. Okay, there's we do have some space for the health plan of San Joaquin to unmute and share any updates if they have any. Okay, I'm going to go ahead and move us forward. Thank you so much. All right, so we know this was a ton of information, and we are so grateful to everyone who shared information today during the provider spotlights, as well as the managed care plan updates and DHCS updates. This has been a lot, and so we also just want to open up this space to tell you all that we do have one-on-ones. We schedule these with the Health Begins team, so this is the facilitation team. And through these, we do overviews of Medi-Cal transformation. We discuss, what is this collaborative? Why are we meeting? Why are we convening? And then we also discuss strategies to effectively engage with your managed care plan. We are in ongoing conversations with them, and so often can provide tips on how to connect with them better. And we also encourage them to join these meetings. So we do have an existing relationship. We also really want to encourage everyone to please join office hours. During these office hours, these are sessions where our great facilitator, John, answers questions for all of you. He is a provider within the San Joaquin Stanislaus region and has a lot of great expertise. But also during those calls, you get to hear from others. So this room might be quiet, but that one is definitely not. We are meeting on Friday, May 24th at 1 p.m. And so we'll drop that link in the chat for you guys. A lot of you already have the calendar invites, but if you would like to get more information on that, please contact us. You can email Navneet at healthbegins.org. Next slide. I do want to share a quick success from office hours. So we are sharing this new SJST Q&A resource document. So we are actually compiling all of your questions and providing you responses from your peers, as well as the managed care plans, information from DHCS. So we're trying to present this in a very clean format so that you can just navigate it really quickly. And these are questions that are being asked across sessions as well as during office hours, and even those that we receive via email. So these are open to all of you. We'll share the link at the end of this session. I shared the PDF deck here, and so you all should be able to click on the PDF deck and click on any of the links that are available there. But we'll be sharing this document, and again, any questions that are coming up during sessions are being uplifted there. Next slide, please. And I'm actually going to hand it over to Navneet to take over. But thank you all so much.
Yeah. Hi, everyone. Good afternoon. I'm just going to quickly recap on our work groups and also help us move to our work groups. So last session, we launched our work groups and had really great conversations in each of the work groups. And we want to take some time during this session to help continue to build upon those goals and move the work forward. So the slide is just highlighting a few of our updates and recap from the work that we did. For the sake of time, I won't go into too much detail. And then we do have some really exciting news. I know we've been in talks and have mentioned this in previous sessions, but we were able to secure a space for our in-person session in June, and we'll be holding that on Tuesday, June 25th from 11 a.m. to 2:30 p.m. At the Health Plan of San Joaquin's Modesto office. So we do have a registration link that we will share out, and we encourage you all to fill it out since space and capacity is a bit limited. We will be providing lunch, but we do want to also highlight that if you aren't able to attend the session in June, we are planning to have another in-person session later this summer, early fall, so definitely keep a lookout. We're hoping to have this in-person convening as a space for us to connect in person and continue to build upon the relationships and share best practices. So we're excited to have the opportunity to gather in person. And following that, we do have 2 quick polls just to get some feedback from you all on what would be most helpful as we're planning and informing the session. So our first poll is just asking about topics or activities that you would like to see included. So I'll give everyone a few moments to fill that out. And if additional thoughts or ideas come up post this session, please feel free to email me. I dropped it in the chat, but I'm happy to drop it again. So we'll give a few more moments and then we'll end the poll.
So if I can just reiterate, so all of these links will be provided for us?
Yes, we'll share
Yay.
that.
Okay, perfect. Thank you.
Yeah, unfortunately, it's a bit hard to share screen and add links, so apologies for that, but we'll make sure that everyone gets the links.
Just making
so
sure.
the office hours link is in the chat, but also the in-person session registration link is also in the chat. So if any of you are feeling motivated to register now, please do.
I think we can end that poll, and then we have one more poll, which is just asking if you're interested in presenting at the in-person session, would like to highlight your services, or interested in co-sponsoring. So it's just a quick yes, no, maybe, and we'll follow up with those that have expressed interest. I'll give everyone a few more moments for that as well. Okay, great. So now I will pass it to John as I do the tech stuff behind the scenes to open the breakout rooms.
Thank you very much, Natalie. So now we're going to do our breakout rooms. So we have 3 breakout rooms that you could choose from. We have work group 1, which I will be participating in, and we'll be discussing network expansion and streamlining of payments. Room 2 is with Navneet, referrals and market awareness. And then room 3 with Gretchen, and she will be discussing eligibility authorizations and data exchange. So if you could choose what room you would like to be, we can go there and have a nice discussion. We'll see you all there.
Yeah, thanks, John. The rooms are all open, so you should be able to self-select into which room you're interested in going into. And if you have any technical difficulties getting into your room, Melissa can help get you to the correct room. So I will see everyone in room 2 who's attending.
Welcome back, everyone.
We're back.
John is going to close us out. Going to pick on him really quick.
Okay, well, I just want to say first and foremost, Esme Chavez from CAPC was giving us a great overview of what she does, and she just got cut off. So if you want to attend an office hour meeting to get some more information from Esme, that would be great. So our next, where's our slides at? Here we go. So this is just our little quick debrief of what we discussed in work group 1. I do believe that the people that I had in there, Esme and Sarah and Candy and Lorena, gave us a really, really great overview of their marketing materials and how they're communicating with their patients, their clients, regarding ECM and CS services. So they do have some things in place that they're doing, but there is some disconnect too. They also agree that more information needs to be provided to all members, whether they're Kaiser or Medi-Cal members. And then we're all looking forward to the justice involved population, where they'll be getting case management starting 90 days before they were released, and that should be starting in October. So a lot of great information on how to scale up and how to put that information out there. And they do have flyers. Candy says that they have a great flyer that was produced by their team, and they provide it to all the hospitals out there. Work group 2?
Thanks, Sean. We also had a similar experience and we were sharing, but unfortunately had to jump. And we had a really great discussion on our in-person session and kind of just coordinating the logistics and topics that we want to keep in mind, including maybe having the opportunity to kind of do provider spotlights in person and maybe coming a little more prepared with a BA or LOI, since a lot of that can take some time. We were also talking about our pop-up provider fair and whether it makes sense to, we had originally planned for doing our in-person session and the fair in the same day, but we acknowledge that that's a really short turnaround and a lot of logistics, including people being out of office, and we want to make sure we plan this event really well. And have the opportunity to market it to the community. So we are thinking about potentially pushing it to June or August. But yeah, those were some main highlights, and I will pass it to Gretchen.
Thank you, Daphne. We had a really fruitful conversation about potential platforms we could check out for streaming dialogues with not just providers who are in the CPI, but also potentially providers that may be interested in ECM and CS and want to come to a place to ask questions and get answers. So I listed them here on the screen. And then we also briefly touched on what we're hearing about. The state's going to push out fairly soon is a notion of pre-authorization for ECM. I know some plans are calling this pre-qualified. We do know of some plans that are saying that everybody on their MIF is pre-qualified for ECM. So, you know, it changes how you get paid sometimes, depending on how the plan is working on outreach versus ECM services. And so we just want to find out more, and we're hoping the state will be releasing some guidance in the next month or two that we can start to act on here in San Joaquin and Stanislaus. And if I missed anything from our group, someone please jump in and remind me. All right, well, thank you guys.
Okay, it looks like we have one more poll. What selection of today's session was most valuable? We have a quick poll to put into place so we can further fit your needs in the future. So please answer that before you jump. I know everybody has a tight schedule with work, so please answer as quickly as possible. All right. And if you just want to go to the next slide. And so the next steps is that we do have, please attend our sessions, session 5 office hours. That'll be on May 24th at 1 p.m. And then register for the upcoming in-person session. And there will be an RSVP link in the chat, and then continue implementing improvement practices. So there is a list here of improvement practices peers are working on. And there will be a link also in the chat. So I just want to say, you know, next slide. Thank you, everybody, for joining, and we'll get you out here with 2 minutes. But if you have any other questions, please come to the office hours that I'll be participating in, and we'll go from there. We'll have a great discussion. Thank you so much.